Hello, everyone. Let's review diagnostic prerequisites in Chinese medicine. And we are very proud to have with us today Sir Jobel from the Visayas.
Adis.
Cadiz, no?
Adis.
Yeah, and also that's Negros Occidental.
Opo.
Yeah, and also Sister Rosa from Tianjin, and of course, Mom Trix, who doesn't want to show her face, from Sampaloc, Manila, and of
Good
course,
afternoon.
Tuloy ba yung tour natin? Tuloy yata yung tour natin.
uh, let's cross our fingers. No, I would rather go there if we already know how to speak a little Mandarin. Okay, we don't want to be embarrassed because all we know is xie and ni hao ma. Mandarin.
That's
Ano,
very
si...
good. That's very good.
Oh, wow, thank you. That's the only one I know. The only thing I know. Okay. Okay, let's start. Let's get started. What is a prerequisite for practicing Chinese medical diagnosis? Go.
Understanding Chinese medicine, physiology, and pathology.
Okay. When the stomach chi moves upward instead of downward, what symptom may appear?
Vomiting.
Hmm. Which of the following can block the stomach chi from descending?
Exogenous cold.
Yeah. What does a normal tongue look like?
Pink without tooth marks and fill cutting.
How thick should be the coating? It should be thin white or thin pale coating. Does everybody agree with the answer? Yeah. Which of
Manipis
the
yung coat.
following is described as a common but not normal tongue appearance for many Northern Europeans? Oh,
Fill with teeth marks and greasy yellow coating.
what do you think they have that kind of tongue? No?
Their diet, cold there.
What is the norm in Chinese diagnostic thinking?
Ner- Manipis yung tang siguro.
No, number 6. What is the norm in Chinese diagnostic thinking?
Okay. The condition is we expect when the body functions perfectly. Perfectly.
Okay. Which diagnostic pillar is not mentioned?
Blood pressure
No, we
measurement.
don't measure the blood pressure. What should you do if you notice a deviation from the norm? What is the first thing that you should do? Hey.
Determine what caused the change.
Okay.
Change.
Which of the following is the possible cause of rebellious stomach chi?
Stomach chi, shu, or weak stomach chi. So, two.
Shu.
Shu.
Stomach chi deficiency. Is it correct? Yeah, correct answer is stomach chi deficiency. When analyzing a patient's pulse, which quality indicates a tight pulse?
Tight pulse. The pulse feels narrow and firm. Patient pulse.
Narrow and firm. Okay. Why is it narrow?
It's cold.
It's cold, so the vessel is constricted, so the pulse should be narrow, no? What does a shallow rapid respiration suggest about the lung?
Lung is not descending and spreading chi properly.
Okay, so actually we have just defined or described the function of the lung, no? Okay, so if you see a patient who, I know someone who is like that. He used to be a patient, but now he knows how to do acupuncture.
Bago lang naka-treat ako ng ganyang pulse daw.
If it's rapid and shallow, so the lung, no? Which of the following is an example of exogenous qi that can affect the stomach?
When cold.
Yeah.
When cold.
What is the main benefit of understanding pathomechanisms?
Reduces the need to memorize long symptom list.
Yeah.
Obviously, this
Number 14, observing fewer signs of imbalance usually means the patient is,
closer to the norm.
okay, which of the
Closer.
following is not a pulse quality?
Metallic.
What analogy is used to describe learning diagnostic skills?
Learning to play the guitar.
Okay, so that's why, diba, it takes time to, especially if you do finger style, right?
Yes, speaking.
Pluck, yeah, what you call, whatever you call it. I don't like the
Pinaplit.
strumming part. It's more of, because you have to exert extra effort. And I'm sure Sister Rosa wants to listen to how you play.
Ding, ding, ding,
Which
ding.
of this is a sign of a normal tongue coating?
Thin, fill, even coating.
What should the practitioner do if they feel they are not observing any signs? So, okay, you don't know what to do. The patient looks normal. What will you do?
Normal tongue coating.
Are you going to give up the patient?
The pulse.
Fill, even coating. Oh.
Okay, I have to admit, when I was new, no, I really don't know what to do. I said, there's nothing abnormal, but as you practice, no, you get to learn the slight deviations. So what is the number one?
Keep practicing daily.
Yeah, keep practicing daily. Which factor, or you practice with your own pulse? Which factor
Yes.
can cause the lung chi to become chaotic?
Exposure to shock.
Yeah. Do you agree, Sister Rosa? Exposure to a shock? Okay. Which diagnostic technique involves looking at the patient's mouth? Of course.
Uh, tongue
Observation. Stomach fart
Tongue
is an
observation.
example of
Heat causing stomach chi to rise.
which of the following is considered a common tongue appearance, not a normal one.
Tail with teeth mark and greasy yellow coating.
Does everyone agree?
for the Northern European.
Yeah. It's feel
Like
like
you.
European. In pulse
Yeah.
diagnosis, which quality suggests a weak pulse?
The pulse feels soft and pivotal.
What does the term utopian state refer to? Wow, utopian.
The ideal normal condition of the body.
Which of the following is an example of exogenous cold affecting the stomach?
Cold weather exposure.
Why is it important to differentiate between normal and common?
Because common findings maybe still indicates imbalance.
Yeah. Which of the following is not listed as a possible blockage for stomach chi?
Heavy metals.
What is the recommended frequency for practicing diagnostic techniques?
Every day or with each patient.
Yes. Which of these is a question a practitioner might ask a vomiting patient? Excuse me. Sorry. What will you ask? Sir Bill.
Okay na daw.
A patient who is vomiting, what will you ask him?
Ah,
Are you going to ask
yung
like music?
tanungin sa kung ano yung kinain niya, kailan kailan yung ano yun, na-experience ang mga symptoms na
What
bakit siya
provokes?
nagsusuka.
Does everyone agree?
Oh,
What
tapos
provokes the vomiting? What does stomach tissue mean?
stomach.
Stomach tissue.
Weak stomach chi.
What does wind cold represent?
An exogenous pathological factor.
What is the main focus when deconstructing the diagnostic process?
Analyze each aspect separately.
After feeling the same pulse quality several times, what may you recognize in a new patient's pulse?
The same quality.
How should the various patterns of imbalance be learned?
By heart. By heart.
Yes. What ability should you have regarding symptoms and signs of imbalance?
Classify and categorize them.
Which type of qi hits the body in Chinese medicine?
Yang Qi. Yang Qi.
Okay. What does yang qi shu indicate?
To little warning, Yang Qi.
Which external factor can block wei qi, preventing warming of the skin?
Exogenous wind cold.
What function does wei qi have?
Warm the skin and control the pores.
What effect does cold have on skin pores?
It causes them to close.
Yeah, that's why you don't sweat. Which diagnostic category includes symptoms like feeling cold, sweat, and muscle aches?
Condition of wind cold.
What is the similarity between a computer and pattern recognition in Chinese medicine?
Both can recognize patterns without understanding why.
Okay. What does an experienced practitioner rely on more than a novice when diagnosing?
Experience.
Yes. Which activities help an experienced practitioner improve diagnostic skill?
Visually observing, interviewing, listening, palpating, and smelling patients.
How does an experienced practitioner handle the first idea that comes to mind?
They become flexible and do not latch onto it.
What tends to be quicker as in an experienced practitioner compared to a novice?
Diagnosing a patient.
When observing a symptom, what does the experienced practitioner automatically know?
What questions to ask next?
What must intuition be based on for it to be trustworthy?
Solid theoretical understanding and practical experience.
Intuition is the ability of the subconscious brain to do what?
Recognize and process previously collected information rapidly.
What risk is associated with using a Western medicine diagnosis as a starting point? So you already know the diagnosis. So this is the problem when you base everything on your Western diagnosis. So what is the risk here?
It may be incorrect.
Why can relying on another doctor's diagnosis be risky for an acupuncturist?
The original diagnosis might be wrong.
What is a major difference between Western and Chinese medicine diagnostic models?
They are based on completely different physiological and pathological models.
What can happen when two practitioners give different diagnoses for the same patient?
The treatment may be incorrect or based on the wrong diagnosis.
What should a practitioner be wary of besides Western diagnosis?
Chinese medicine diagnosis made by other acupuncturists or herbalists.
What is the relationship between intuition and conscious thought?
Subconscious process shorts information faster than conscious processes.
Which symptom indicates that wei qi may be blocked by exogenous xie qi?
Nose waiting and muscle aches.
What does the phrase learn everything by heart mean?
Memorizing symptoms and signs of its pattern.
Are you sure? Do you have any other answer, sister? I think the answer here should be okay. Learning to play.
Memorize.
Yeah. I think. What do you think, Mantrix?
Yes,
Learning to play a musical instrument, no? Because when you play a musical instrument, it's like, do you agree, Sister Rosa?
Okay.
I don't know. Maybe, yeah. What do you think? Any comment?
Maybe also practicing meditation can also be.
Maybe, yeah. Or maybe all of the answer. Definitely not studying heart anatomy.
Yeah.
I think you just memorize. Yeah, I think number one, I
Learn
think is the
everything
strongest
by
answer,
heart.
no? Yeah, I think the number one. But I'm not
Yes, I think it's number one.
I think it should be number one.
Mm.
Yeah, because if you
Yeah.
memorize, you know all the number one. I'm just a
Oh,
little biased with music.
related.
What is the main advantage of an experienced practitioner's intuition?
It allows rapid, accurate conclusions based on prior knowledge.
Yeah, because you get to see the same cases, no? Sometimes you learn from mistakes, so you don't commit the same mistake. What does an experienced practitioner do when faced with a new symptom?
Quickly knows which additional signs to look for.
What does cold condition refer to?
Envision of oxygenous she cold.
Which hallmark sign is associated with the function of Wei Qi?
Warming the skin.
What is the relationship between intuition and theory?
Intuition must be grounded in solid theory and experience.
What does Chinese medicine use to select acupuncture points?
Understanding the actions in Chinese medicine.
Will a Western diagnosis of a spleen problem guarantee that spleen 3 will affect the spleen? Excuse me, sorry.
No, not certain.
Yeah, no.
Or not certain.
Yeah, because sometimes when you automatically you'll see it may not be the original problem, right? Okay. What must match the treatment in Chinese medicine?
Diagnose.
Yes. In Chinese
Diagnosis.
medicine, what is the foundation of diagnosis?
Differentiation of disorders and patterns.
What does a Western diagnosis often relate to that is not found in Chinese medicine?
Hormones.
Yeah. Which organ's qi is related to intestinal flora functions?
Spleen.
Can we directly equate estrogen with kidney yin?
No.
What should be done after receiving a Western diagnosis?
Deconstruct into symptoms and reconstruct in Chinese terms.
Which acupuncture point treats estrogen imbalance?
Kidney tree.
Yes. What type of diagnosis is a Western diagnosis described as?
Bayan Bing Lonzi. Bian Bing Lonzi.
Disease pattern. What process is important when treating patients with the same Western diagnosis?
Individual pattern differentiation.
What should we look at in patient besides Western symptoms?
Chinese signs and symptoms.
What may indicate heat in the heart?
Rapid talking and gesticulating.
Do you have patients like that? Like this person?
Parang hindi mo maintindihan.
Yeah. What is the purpose? Mabilis magsalita, yeah. Sometimes senseless, no? And they make gesticulations. What is the purpose of translating diagnosis to our own diagnostic models?
Too much treatment.
Which of these is not a possible disturbance in Chinese medicine?
Vitamin D deficiency.
What do Western doctors say about treatment based on the Chinese diagnosis?
They would say it does not make sense.
So we should educate them. What does Yan Cheng Lun Qi refer to?
Pattern differentiation diagnosis.
What should be correlated with all other patient signs?
Symptoms and signs from Western diagnosis.
What is the relationship between spleen qi and intestinal flora?
They overlap but are not identical.
Which point might be used to warm kidney yang?
Kidney tree.
What is the value of patterns of imbalance?
They guide individualized treatment.
Which of the following is a Western factor not found in the Chinese medicine model?
Neurotransmitters,
What is essential for treatment to be effective?
matching diagnosis and treatment.
What does Pian Ping Lun Chi refer to?
Disease classification,
Using Western hormone levels directly in Chinese treatment is?
not appropriate or to equate directly.
Which of the following is not a possible cause of rebellious stomach chi leading to vomiting?
Excuse. Excessive food intake or cold food intake. Excessive food intake.
Okay. What characteristic is described as common but not normal for a tongue?
Greasy yellow coating on the root with red tip.
Yeah, this is very common, no? Which of the following pulse qualities is possible descriptor during pulse diagnosis?
Slippery.
The lung should perform which function for proper respiration?
Descend and spread chi.
Which of the following is identified as a diagnostic pillar that must be learned?
Pulse palpation.
When observing a tongue, what combination of features constitutes a normal tongue?
Pink without tooth marks and feel even coating.
So what if you see teeth marks? What is your diagnosis?
Teeth marks, chi stagnation.
Jesus name. Hindi pa.
Spleen
Start with
deficiency.
spleen chi deficiency or
Plain
spleen
chi.
lung deficiency if there's cold symptom, no?
Okay.
Not stagnation. Actually, you don't see anything when there's stagnation. Not much. Especially during the early stage. Okay. Oh, okay. A shallow, quiet breathing pattern indicates a malfunction of which organ?
Lungs.
What is the primary reason some practitioners avoid pulse diagnosis?
Perceived difficulty and lack of competence.
So let's study, no? Which of the following is not listed as a possible obstruction to the descending movement of stomach chi?
Not listed possible blood deficiency.
Yeah. Which of the following pulse qualities is described as tight?
A pulse with feels hard and constrained.
Exogenous sear chi is a factor that can cause which of the following patterns?
Stomach chi rise due to heat.
Okay. Which diagnostic skill is described as needing daily practice, similar to learning a musical instrument?
Pulse diagnosis.
The norm as is the expectation of what?
A normal expectation of what? The ideal, perfectly harmonious state of the body.
Okay. Thank you very much, Sir Jobel.
Thank you po.
Excellent job. Congratulations. See you again.
Thank you.